Hi guys, it's me, Sylvia Gordon. My husband got me into downhill mountain biking, and I don't know if I'd exactly recommend it at age 52, but it's really fun. My little ramp, that's my little baby skills course he made for beginners, that I'm very proud of. If any of you or your kids mountain bike, you're not going to be very impressed with it. I want to talk about something very simple today, and that is how to get Medicare Part A. For those of you that are agents, you probably don't even go into this with your clients. You don't go into it enough because we get lots and lots of calls from our videos, emails, and questions from clients calling in about Medicare Part A. Medicare Part A you don't sign up for. You don't have to do anything except work for 10 years, 40 quarters, be married to someone that did. So most people are in the workforce for at least 10 years. When they turn 65, and I'm doing this video right now in 2018 on the offshoot, you're watching this in the future, and they have actually moved the age of Medicare Part A up, which they should, but they won't. Right now it's 65. 65. If you've worked 10 years, you're going to get Medicare Part A and you don't have to do anything. It's automatic. They will send you a card and it'll say Medicare Part A, and it'll have the first day of the month of that you turn 65. Even if you're still working and you don't want Medicare, even if you don't want Social Security and you want to delay it till 70, you have your own health insurance plan or you don't want anything, you still have A, and you're not paying for A, you paid for A the whole time you were working. So you probably noticed this, but every week they took money out of your paycheck. Part of that went to Medicare. So your Part A is paid up at 65. So you don't have to do anything. You don't have to call the Social Security office, go in, fill out any forms. You have Medicare Part A. Now there are some people that didn't work there 10 years, they're 40 quarters, or weren't married to someone that did, and maybe only worked for 30 quarters, in which case they can buy up the rest of their Part A. There's more rules about that exceed the limits of this video. If they're going to pay for it, it's going to cost some money, at least $300 and some per month. But the majority of Americans work 10 years, they're going to have Part A automatically, they're going to get that card. When you get Part A, you are then eligible for Part D for a drug plan. And that's a key thing, because a lot of people don't realize that. A lot of agents don't make that distinction. So when you get A, you're eligible for D. You have to sign up for Medicare Part B, and the same thing. You could sign up, you're eligible on the first day of the month that you turn 65. You can sign up 3 months in advance. I recommend you do it far in advance. When you have A and B, that's called Original Medicare. And Original Medicare pays about 80% of your medical expenses. It'll pay $0 for your medications. So you will need to get a Part D. To get Part D, you only need A. Now, if you want to get a Medicare Advantage plan, Medicare Advantage is called Medicare Part C. To get a Medicare Advantage plan, to get Part C, you have to first have A and B before you can sign up for C. If you want to get a Medicare Supplement plan, and I recommend when you are eligible for full Medicare for A and B that you do supplement it with either a Medicare Supplement or a Medicare Advantage. One's not better than the other. They're both good. They're different. It depends on you and your needs. That's where your agent comes in. If you don't have a good agent that you trust, that's well versed in this, and I'm not talking about an agent that sells, your house and your boat and covers your motorcycle, and that could write you a policy but doesn't really understand Medicare. You need somebody that really specializes in Medicare. It's very confusing, and bless them, they change it constantly. So it's very difficult to stay up with it. You don't want someone that dabbles in Medicare. If you don't have an agent, you can call us, call the number on the screen. We can recommend an agent that's local to you, or you can work with us over the phone, through email, electronic signatures, however you'd like to work. We'd like to help you with your Medicare. If you just have some questions, it's free to call us. No consultation ever costs you any money. We'll be happy to answer questions regardless of your age, if you're helping your parents, your grandparents, or if it's questions about you and your own policy. Thank you.